Hi there, I'm Dr. Jim Collins. Thanks for stopping by. I would like to talk about a really interesting syndrome, or I guess we could call it an illness, and it's called Cannabinoid Hyperemesis syndrome. It's really interesting. This is a new and somewhat mysterious syndrome known as Cannabinoid Hyperemesis syndrome, or CHS for short. And it is affecting some individuals who smoke cannabis 3 to 5 times a day for an average of between 5 to 15 years. So that would be pretty regular use of cannabis. And up to 33% of these cases involve those who have smoked it only 1 year or less. So there is some variance in how it affects individuals and the length of time using marijuana. While there are a few studies about its causes, a prominent theory suggests that it's caused by a genetic polymorphism or mutation in the CYP450 gene, so it's genetically based. Enzymes associated with this gene metabolize cannabinoids, and a mutation in it can cause an accumulation of nausea-inducing cannabinoids, which is the opposite of what it's supposed to do. Individuals can experience severe symptoms many times before this condition is even discovered or realized. This syndrome is sometimes mistaken for cyclical vomiting syndrome because the symptoms are very similar. The main difference, though, between the two is that CHS is also accompanied by anxiety, depression, and migraine. So you have the vomiting, that's one thing, but then you have the psychiatric side effects and migraine headaches. The syndrome is divided into 3 phases: prodromal, hyperemetic, and recovery. The prodromal phase typically lasts between a few months to a couple years and is associated with stomach issues and morning sickness. The hyperemetic phase lasts a day or 2 and involves intense vomiting and nausea. The recovery phase can last from days to months and is associated with a return to normal eating and better health. So it can be reversed. According to the research, completely stopping the use of cannabis is the only way to alleviate symptoms and prevent them from recurring. Individuals experiencing any of these phases or symptoms should seek medical attention. Sometimes taking a hot shower can prevent some of the symptoms. The topical application of capsaicin may also be helpful. Both may be associated with the transient receptor vanilloid subtype 1, or TRPVI, which is activated with cannabis use. So there's a connection there. So it's important to be honest with your healthcare provider if you're having any of these symptoms or if your symptoms are bothersome to you. Stopping the use of cannabis helps, but using cannabis again will usually jumpstart these symptoms all over again, and there will be more vomiting, depression, anxiety, and migraines. And I'm sure you don't want that. So here is your CBD Minute. I'm Dr. Jim. Keep coming back for more.